You struggle every single morning to open a simple jar in your own kitchen and cannot understand what is happening. Your hands fatigue so quickly now during basic daily tasks like carrying groceries that you have started avoiding those activities. You notice your grip giving out faster than it ever did before during ordinary moments throughout your regular daily routine. Your weakening hands are not just an inconvenience, but they are actually warning you about your heart attack risk right now. Your grip strength is declining right now and silently increasing your risk of a fatal cardiac event every single day. Your weakening hands reveal deep systemic cardiovascular damage occurring inside your body that standard blood tests completely fail to detect. Research proves your cardiac death risk climbs 17% for every 5-kilogram drop in your total grip strength measurement. Your hand is a direct window into your cardiovascular system, and the simple test to check it takes only 10 seconds. This video is for educational purposes only and does not replace professional medical advice from your doctor. Cardiovascular disease remains the leading cause of death globally. Prediction tools save lives by enabling early intervention. Blood pressure, cholesterol, and glucose are the standard cardiovascular risk markers. All require laboratory equipment or medical devices. The hand dynamometer costs $15 to $25. It produces data that in some studies outperforms systolic blood pressure. Grip strength is not merely a fitness metric. It is a systemic biomarker reflecting vascular, muscular, and inflammatory health simultaneously. Number 7. The cheapest health tracker available. A $15 hand dynamometer provides monthly cardiovascular risk data at home. A continuous glucose monitor costs hundreds of dollars monthly. A smartwatch costs hundreds of dollars upfront. Both measure narrow parameters. A calibrated hand dynamometer costs between $15 and $25 and provides validated cardiovascular and mortality risk data. Test at the same time of day, after a brief warm-up, with your elbow bent at 90 degrees and wrist neutral. Perform 3 maximal squeezes with each hand. Record the highest value from your dominant hand as your reference measurement. Track your monthly results in a simple notebook or spreadsheet. Trending data matters more than any single measurement in isolation. A consistent downward trend over 3 to 6 months warrants medical evaluation, even if absolute values remain within normal range currently. Share your measurements with your physician. Most geriatricians and cardiologists now recognize grip strength as a validated clinical assessment tool. Monitoring this number monthly costs you 60 seconds and provides data that institutional medicine charges hundreds of dollars to collect. Number 6. Grip and brain health. Weak grip strength predicts faster cognitive decline and higher dementia risk independently. The Cardiovascular Risk Association of grip strength is well established. The cognitive risk association is equally significant and often overlooked. Multiple longitudinal studies confirm that weaker grip strength in midlife predicts faster cognitive decline over the subsequent decade. The UK Biobank study, involving nearly 500,000 adults, found grip strength inversely correlated with dementia incidence rates. This connection is not coincidental. Sarcopenia and neurodegeneration share overlapping inflammatory and metabolic pathways at the cellular level. Insulin-like growth factor 1, IGF-1, supports both skeletal muscle maintenance and knee survival and synaptic plasticity simultaneously. Low IGF-1, which accompanies muscle loss, removes a critical neuroprotective signal from hippocampal and prefrontal cortical neurons. Chronic systemic inflammation, which drives both sarcopenia and atherosclerosis, also drives neuroinflammation and accelerated neuronal death. Maintaining grip strength is therefore a simultaneous investment in cardiovascular integrity, muscle mass, and long-term cognitive preservation. Number 5. Training protocol. 4 specific exercises improve grip strength measurably within 6 to 8 weeks at any age. Grip strength responds exceptionally well to targeted training. This is not genetics. This is physiology that responds to stimulus. Farmer's carries are the foundational grip exercise. Hold heavy dumbbells or kettlebells at your sides and walk for distance. Dead hangs from a pull-up bar. Apply sustained tension to every muscle and tendon from fingertip to shoulder simultaneously. Hand gripper tools with adjustable resistance allow progressive overload precisely calibrated to your current functional grip capacity. Towel wringing, both dry and in water, recruits the intrinsic hand muscles that standard barbell exercises frequently fail to target. Train grip 3 times per week with at least 1 recovery day between sessions. Tendons adapt more slowly than muscle tissue. Older adults show measurable grip improvement within 6 to 8 weeks of consistent targeted training in clinical studies. Do not accept grip decline as inevitable aging. It is a modifiable risk factor requiring the same attention as your blood pressure. Number 4. The jar test. If you cannot open a new sealed jar, you are below the clinical grip strength threshold. You do not need a dynamometer to perform an immediate functional grip assessment right now in your own kitchen. Find a new factory-sealed jar of any food product that has never been previously opened by anyone in your home. Attempt to open it using only your dominant hand without any assistive tools, rubber grips, or assistance from another person. If you cannot open a standard-sized new jar, your grip strength is likely below the clinically significant threshold for your age. This is not a perfect clinical measurement. It is a rapid, real-world, functional screen that requires zero equipment. The torque required to break the vacuum seal on a standard jar approximates the threshold values used in clinical frailty assessments. Men aged 60 to 69 should generate 35 to 40 kilograms of force on a hand dynamometer for normal range. Women aged 60 to 69 should generate 20 to 25 kilograms. Below these values, intervention is clinically indicated. Number 3. The biological mechanism. Sarcopenia and atherosclerosis share the exact same inflammatory pathways inside your body. The correlation between grip strength and cardiovascular outcomes is not coincidental. The biological mechanism is direct and well characterized. Sarcopenia, the pathological loss of muscle mass with aging, and atherosclerosis, the accumulation of arterial plaque, share a common cause. Chronic low-grade systemic inflammation, driven by elevated interleukin-6, TNF-alpha, and free active protein, accelerates both simultaneously. Inflamed arterial walls develop endothelial dysfunction. Inflamed muscle tissue undergoes accelerated protein catabolism and fiber replacement with fat. Skeletal muscle is the primary site of insulin-mediated glucose uptake in the body. Sarcopenic muscle becomes profoundly insulin-resistant. This insulin resistance creates the hyperglycemic and hyperinsulinemic environment that directly promotes arterial plaque formation and progression. Mitochondrial dysfunction links these processes further. Mitochondria that fail in muscle cells also fail in cardiomyocytes and endothelial cells. Grip strength is the accessible surface measurement of a systemic process occurring simultaneously in your muscles, arteries, and heart. Number 2. The PURE study. In 139,691 adults across 17 countries, grip strength out blood pressure. The Prospective Urban-Rural Epidemiology Study, PURE, is one of the largest cardiovascular cohort studies ever conducted globally. It enrolled 139,691 adults aged 35 to 70 from 17 countries across 5 continents over 4 years. Researchers measured grip strength, blood pressure, cholesterol, waist circumference, and multiple established cardiovascular risk markers. In the analysis, grip strength predicted all-cause mortality, cardiovascular mortality, and major cardiac events with greater statistical power than systolic. This does not mean blood pressure monitoring is unimportant. It means grip strength adds independent and powerful predictive value. The effect was consistent across all 17 countries, all age groups, both sexes, and all socioeconomic categories studied. A 5-kilogram reduction in grip strength increased cardiovascular death risk by 17%. Independent of all other measured variables. This is the most robust evidence base of any functional physical assessment tool in the cardiovascular epidemiology literature today. Number 1. The Vitality Index. Insurance companies and geriatricians now use grip strength as the primary validated frailty screening tool. Frailty is the medical term for a state of reduced physiological reserve that predicts catastrophic outcomes from minor stressors. Hip fracture, minor infection, elective surgery, and brief hospitalization can trigger irreversible functional decline in frail individuals. Grip strength is now the primary validated frailty screening tool recommended by major geriatric medical societies internationally. It is faster than walking speed tests, more accessible than balance assessments, and more sensitive than body weight or BMI alone. Several major insurance companies have incorporated grip strength measurements into long-term care risk stratification and premium calculation models. Hospitals use grip strength to predict surgical complication risk, postoperative recovery time, and likelihood of discharge to rehabilitation facilities. A patient who enters the hospital with strong grip strength statistically recovers faster, experiences fewer complications, and returns home sooner. Your grip strength today is a prediction of your resilience to every medical challenge you will face in the years ahead. Your handshake is not just a social gesture. It is a cardiovascular biomarker that cardiologists and geriatricians now take seriously. By measuring your grip, training it consistently, and tracking the trend, you monitor your systemic health with extraordinary efficiency. You possess the power to strengthen your grip, lower your cardiac risk, and protect your cognitive future simultaneously. Test your grip today. Find a jar, buy a dynamometer, begin training tomorrow. The data is clear and the action is simple. Subscribe, tap like, drop a comment below. Share this Lancet finding with everyone whose heart health you care about deeply.